Let us now go to abnormal metabolism of body fluids. The topic is disturbance of relationship among fluids, qi, and blood. The relationship among fluids, qi, and blood is very close. Abnormality in any one can affect the other two and induce disharmony in their functions. The following are the principal pathological patterns. First is retained water obstructing qi. This situation arises mostly because fluid metabolism has been disrupted, so the transformation by qi is abnormal. As a result, water is retained and diminishes the functions of the visceral organs. For example, room in the lungs causes blockage and bottling up of lung qi. Consequently, the lungs' depuration function is impaired, and this leads to such symptoms such as fullness, coughing, and orthopnea, which is difficulty with breathing on lying down. Room in the heart obstructs the movement of heart qi and restrains heart yang. There may then be palpitation of the heart and cardiac pain. Next is qi collapse from fluid loss. This condition is due to massive fluid or blood loss. Since fluid, like blood, is a carrier for qi, there is massive escape of qi accompanied by yang along with the lost fluid. The most common causes of such massive fluid loss are high fever consuming the fluids, profuse sweating, and severe vomiting and diarrhea. Clinically, in addition to the massive loss of fluids or blood, there may be shortness of breath, shallow respiration, cold limbs, and an indistinct and fading pulse. If this condition persists, separation of yin and yang may develop and death may ensue. Third is drying of blood from depletion of fluids. This is a pathological state in which fluids are so depleted that blood becomes dry, that is, severely insufficient. As a result, endogenous deficiency heat or endogenous wind is generated. The fluids are an important component of blood, and they have a common source in the acquired essence from drink and food. The principal causes of drying of blood due to fluid depletion are high fever or extensive traumatic burn, massively consuming fluids, massive blood loss causing collapse of the fluids, or persistent heat and yin deficiency insidiously consuming fluids. The main symptoms are anxiety, dry nose and throat, hotness in the five centers, dry mouth with strong thirst, emaciation, oliguria, a red tongue with scanty saliva, and a thread-like and rapid pulse. The fourth is blood stasis due to fluid deficiency. Plentiful fluids ensure fullness of blood vessels and smooth circulation of blood. If there is massive consumption of fluids, whether by high fever, traumatic burns, vomiting and diarrhea, or profuse sweating, the volume of blood is also markedly reduced and its circulation impeded. Under such conditions, stasis of blood may develop. In addition to the symptoms of fluid deficiency, there may be cyanosis of the tongue, petechiae or ecchymosis in the skin, or other rashes. Thank you so much for your attention.